Hello everyone, my name is Dr. Brian Trainor. We're coming here live from the Center for Health and Wellbeing. I'm a first-year naturopathic resident here and part of the team. And so today I'm going to be talking about a unique treatment called nebulized glutathione. And by the end of this video, you'll understand how to do at-home treatments where you basically are breathing in different nutrients. And so today I'm going to go over the procedure and talk a little bit more about this compound glutathione. Glutathione, many of you may know about as the master antioxidant of the liver, and it is key in all of our mitochondria, and it basically helps detox, but also when we inhale it, it helps to clear out any sort of congestion that we have or any damage to the lungs by getting it directly into our respiratory tract. And so for patients that have dealt with mold, or possibly an infection like COVID, or even just the common cold, getting medications and nutrients directly into our respiratory tract can really help. And so some of you may even have been prescribed this treatment by one of your integrative providers here. So I wanted to do a video today to demonstrate how to do it. I actually took a nebulizer home myself as a patient. As you can tell, I have some congestion now, and I had to Google or look up on YouTube another video of how to do it because there's a lot of moving pieces. So to start, this is a nebulizer. The one we sell here that we will give to you if it's prescribed to you is a little bit more compact, but this is one we have for the office. Basically, there's an on and off switch, and I'm going to show how to hook it all up and how we're going to do this. And it's a little bit loud, so I'm going to do it real quick. So it's a little annoying, but you'll see it's kind of soothing as you get into it. So gloves are not necessary, you don't need them for when you're at home, but for the purposes of this video, I will demonstrate with gloves because we will be pulling out a needle, and I think it's best practice to do so. So gloves may or may not be used at home. So to start, we're gonna clean our top. So this glutathione bottle is 30 mLs, and each treatment will use 3 mLs, so it comes out to 10 treatments with one bottle. And so this does need to be prescribed to you here, so it's not something you're gonna find at Sprouts or anywhere else, this injectable glutathione. So you clean the top really well, making sure any sort of bacteria that was on there is gone. Then we're gonna open our 3 ml syringe. So if you order a kit, we generally send you home with about 14 of these. And so we're gonna fill it up to the 3 milliliter line. And so basically, we go straight in here, take off the cap. You're pushing it in first, and then we're drawing it up. As you can see, we're getting some nice glutathione in. Yep. So, there we go. I wanna make sure we're getting it all the way up to the 3 ml line. You wanna make sure your needle is not past the water level. As you get lower, you might have to pull it out further. And if you go a little past or just before 3, that's fine. So right around 3 mLs. Oh, I didn't get quite enough. I'll draw a little more. Good. And so this is ready. I'm going to recap. And then I'm going to show you how to get this part. This is going to be the tubing that comes from the nebulizer that'll ultimately end up in our mouth that we'll breathe in. Now you can get a face mask, but I do find that this kit that I'm going to show you, we use either face masks or this mouthpiece, and I like the mouthpiece better because we get a little bit more inhaled directly in, whereas the mask, we lose a little bit out to the sides. But many are familiar with oxygen masks, it's the same thing. Okay, so I'm just gonna put this together the way it goes. So first, the tubing will go from the machine over here. I'm trying to turn it so everyone can see. You'll hook one end of the tubing onto the machine, and then the other one will go onto here. But before I do that, I just want to show the mouthpiece goes on here. Sometimes there'll be an extension kit on here. It's not necessary that we breathe through. But basically, we're going to breathe in through here, nice and deep, and then breathe out. When we keep it in our mouth, I just can't talk with it. So I'll demonstrate once I fill it up. So I want to keep this clean as well. So next we're gonna put the glutathione and the saline. So you're gonna get sent home with 10 to 15 of these as well. This is pre-filled to 10 mLs. It's the closest we had. So we're basically going to use this one for every treatment. You can use it's going to be 5 milliliters total. So I'm going to inject 5 milliliters into, if you notice there's an inside here, you're basically just putting it around the outside. So I'm going to go 5 mLs. So we started at 11. So I'm going to squeeze down to 6. It doesn't have to be perfect. The ratio of 5 mLs of normal saline to 3 mLs of glutathione seems to work well. You could inhale directly glutathione. It just may be a little bit more irritating, and it smells a little bit more like sulfury eggs, so some people don't like that. So next we're going to inject the 3 mLs we already drew up of the glutathione. And you could have done this once you already had this all set up. You could have waited to do this. But ideally, we're going to send you home with enough syringes, so for safety and all that, make sure you recap the needle. And ideally, you can bring it in to be disposed in a biohazard bin. That's the best way to do it at your next visit. So the final step, now that we have all of our solution in here, is to screw this back on. And now we're going to hook the tubing onto this bottom part here. So as you can see, there's a lot of little steps, but like I said, this can be a really magical treatment. In fact, as you can hear today, I have some congestion myself, and this treatment is something that I'll do. This amount will take about 15 minutes, and so to use up, so 15 to 20 minutes is a normal length of a treatment. So I'll do a few rounds of breath so you can watch how I do it and how I recommend doing it at home. All right, here we go. It's gonna be a little loud, so bear with us. Okay, so we would continue that. I already feel better. So the lungs are a unique way of getting any sort of nutrient in, and as we breathe in, things work differently than if we take them as supplements or if we get them intravenously. So hopefully this video helped you learn a little bit about this. We can also do things like colloidal silver and NaC. So once you purchase the nebulizer, there's many other options. So work with your integrative provider here, and I hope that this was helpful for you.